I am Luna Gargani from the Institute of Clinical Physiology in Pisa, Italy. We are here at the ESC Congress in London, and we have Dr. Emiliano Angeloni from La Sapienza University in Rome. So he has just presented his data on postoperative lipids management in patients with bioprosthetic heart valves. So can you tell us about the aim of your study?
Well, we focused on lipid management strategies after heart valve surgery with bioprosthetic valves.
Okay, and what was your study population?
Well, we included a total of 1,300 patients without cut receiving a bioprosthetic valve, and we divided them into 4 subgroups. One made up of those patients receiving statins and attaining at the LDL goal of 100 mg per deciliter, and one of those patients not receiving statins but still attaining at the LDL goal, and then the other 2 subgroups of patients that did not reach the LDL goal, whether or not they were on statin treatment.
Okay, so and what was the main result of your study?
Main result of our work was that patients receiving an effective statin treatment did show a better 5-year survival, free from MACE and free from MACE and free from prosthetic valve deterioration. On the other hand, we have to say that patients on statins whom did not reach the LDL goal did show similar results to those not receiving therapy.
Okay, so do you think the benefits are more linked to the cholesterol lowering effects or to the anti-inflammatory and pleiotropic effects of statins?
Well, actually, pleiotropic effects of statins are surely involved in the additional beneficial effects of statin treatment for such patients. And this may explain why in our study, between patients with same lipid levels, those receiving statins showed better outcomes. Conversely, those pleiotropic effects alone, in the lack of adequate lipid levels control, are not enough in order to ameliorate the outcomes.
Okay, so it seems that a tight lipid control is crucial not only in coronary artery disease, but also in valvular heart disease, as the two conditions share some basic pathophysiological process.
Yes, as you know, degenerative degeneration of prosthetic valves shares many patterns, physiological patterns, with atherosclerosis. For example, the upregulation of LRP5, which is a target of statins, inhibited by statins. So theoretically, it is possible that statin exerts such a protective effect against prosthetic valve deterioration, but I think that basic science studies are needed to confirm that.
Yeah, and what are the main limitations of your study?
Main limitation of our work is surely its retrospective nature. Despite a priori definition and prospective collection of data, it is still possible that unidentified confounders, due to the lack of random allocation, may affect the results.
Okay, so a final take-home message in one sentence?
In one sentence, I would say that the optimal treatment strategy for patients who receive a bioprosthetic heart valve is a secondary prevention strategy including both statins prescription and lipid goal achievement.
Okay, thank you so much.
Thank you very much.